Michael Dudley with Cohort Intelligence. I have an awesome patient success story I'm looking forward to sharing with you today. I think today's world, we're just there's just too much focus on negativity, and I want to bring up a positive story, one that's encouraging, uplifting, and hopefully puts a smile on your face between one of our care navigators and one of the patients that they manage. As a brief background on Cohort Intelligence, we're hired by a primary care provider to reach out to their patients and spend about 20 minutes with them per month to be able to help them provide education, accountability that hopefully leads to lifestyle changes and keeps that patient out of the hospital. And completely paid for by Medicare, so it's an awesome program, and we love working with our patients. In this story, one of our care navigators, Tanya, enrolled a patient about 3 months ago. For PHI reasons, let's just call her Jane Doe, who is a woman in her mid-70s who lives alone and had recently a hip replacement, also suffers from chronic knee pain. Despite all that, she volunteers her time every day and cooks dinner for about 40 people, so she's much more active than your average 70-year-old. Jane's, though, had trouble here recently feeling good about herself due to her weight and multiple conditions, including hypertension, hyperlipidemia, and a number of other conditions that impact her health on a daily basis. She was taking a number of medications for her conditions, but had stopped taking her statins completely because of some aversions to taking the multiple medications. So when one of our care navigators, which we like to call superheroes, start working with a patient, they like to focus on building a patient bond first and foremost. That later translates to that behavior change. In this case with Jane, Tanya was able to connect on a personal level because they're both relatively short. Tanya empathized with Jane over how minor weight gain can affect her small frame and overall mental health. Getting personal is crucial because Tanya feels if a patient doesn't connect with me as a caregiver, why would they listen to what I have to say? After that powerful patient bond is established, Tanya found out early on that Jane was very motivated to minimize her medication intake. So she coached Jane on ways to tackle weight loss through portion-controlled, low-fat, and low-sodium diet, along with regular exercise to help her improve her health conditions. Tanya continues to reinforce the importance of medication adherence, and they're now working together, leveraging the goal of minimizing that amount of medication taken as something to work towards and to be held accountable to. To give you a glimpse into their relationship, since Tanya's caller ID comes from the practice that's hired us, Jane always answers that number. Tanya, what's going on? I'm excited to hear from you today. The biggest benefit of chronic care management for Jane is just having an encouraging voice in her corner. She doesn't have many friends or family to talk about her health, so Tanya has become a support system, continuously providing education and coaching on proper eating habits and regular exercise. After highlighting the importance of regularly monitoring blood pressure levels, Tanya got Jane in the habit of not only just checking those levels, but also logging each reading so that they could measure her progress over time. When Tanya started working with Jane 3 months ago, her blood pressure was 148/91. And during their conversation just last week, Jane's last reading was 125/72 and has lost 4.5 pounds. Phenomenal progress. So, of course, losing weight meant that she felt better about her health and her self-esteem improved, but she also led to her doctor stop prescribing her statins completely and suggested the suggested dose for the blood pressure was cut in half with the possibility of potentially discontinuing it in the future. So saving the best for last, Jane shared with Tanya that her chronic knee pain had subsided enough that she had postponed her total knee replacement surgery, something she didn't even think was possible. So not only is she in a better place physically and mentally, but she can now avoid that long-term rehabilitation stint and continue her selfless act of cooking for vulnerable members in her community. Between a combination of medication compliance and diet lifestyle coaching, Tanya's made a major impact in her patient's journey to better. As for Jane, her accountability to herself, to her care plan as prescribed by her primary care provider, and to our care navigator herself, all helped Jane become a better patient. So Tanya's just one of the many superheroes we have here. If you'd like for us to assign a team of superheroes to your patients and hopefully be able to repeat the same success, completely on behalf of Medicare's dime, please look out for my contact information in the description of this video. I'd love to be able to help you repeat the same success and hopefully make your patients on their journey to better. Have a great day.